All right, so we're back to cervical. So if I'm setting my table up at this height, what is going to be my grip?
Cradle.
Yep. I'm a little bit higher. I'm going to use my cradle grip. Okay.
I like it so much better.
And then we've talked about we've dialogued a lot about, like, okay, here's my lateral glide, or my almost like my moonwalk or my shimmy, right, to try and identify the lesions in question. Granted, Ian's a little bit looser than previous. Go ahead and bend your knees and put your feet flat. Good. And that just lets his torso sit flat and has implications on the cervical spine tension. So definitely still right-sided, better than when we started today. So there's my free rotation. The parameters and the steps are the same. Free rotation, side bend, side shift, PA shift. The only thing that changes based off like whether I want to go lower or higher on the cervical spine is where my short applicator is and where my vector of force is at, right? And so it's going to be a rotary technique. I'm gonna have this pulling under around the back side of the axis of the cervical spine in the head, and then this hand's gonna be thrusting up and around like that. So if we were gonna find the segment in question, we just got a lot of tissue tension. So this is one technique that I often use is if I feel a lot of tension like this, I'll often like come in and just like sit on like upper trap / first rib and have them breathe for about 2 minutes straight. 4 seconds in, 8 seconds out. This helps to get some reflexive relaxation, allows me to get into the joints a little bit more. He's got plenty of motion despite the resting tension in his neck. But again, the more tension that exists within the muscles, the faster I need to be. Again, I need to be closer to those 800 milliseconds versus the 200 milliseconds. So slight rotation, side bend, side shift. I come up, and it's a quick thrust. That was a rather larger amplitude than was otherwise intending. Still successful on that mid-cervical. If I was going to come to the other side, I won't actually thrust so that we can have some practice with Ian. But here's my, I need to lower the table just a little bit. Thanks for that. Okay, so I'm going right to groin height. Forearm lie down. I just roll his head onto that said arm. Okay, this is what we did for our OA. This is my atlas. High arc of rotation, and then here's my C2, C3, C4, C5. It's the same technique. Here's my pure rotation. Here's my rotation and side bend, which gives me a little bit of additional leverage, a little additional pops, and then it's fast on and quick arrest, again allowing the cervical spine to continue to rotate underneath the occiput.